Okay, let's unpack this. Today we're taking a deep dive into a really serious global public health problem, one that often goes misunderstood: female genital mutilation and cutting, or FGMC.
Right.
And this isn't just an issue over there, it's actually a concern right here in the U.S. We've pulled some key info for you from a continuing ed article for Pediatric Nurse Practitioners. It really highlights the definition, the profound consequences, and also the critical cultural implications. Our mission today is kind of to cut through the noise, give you the essential facts.
Yeah, get to the core of it.
Exactly.
Yeah.
And help you understand why this isn't just some distant problem, but one that truly matters globally and, well, right in your own community.
And what's fascinating here, or maybe sobering is a better word, is how FGMC is defined by the World Health Organization. Essentially, it's any procedure involving partial or total removal, or any other injury to female external genitalia for non-medical reasons. It's categorized into 4 types. And type 3, which is known as infibulation, that's the really severe narrowing of the vaginal opening, that causes the most significant long-term consequences.
Wow.
And the scale is just, well, it's huge. Over 200 million girls and women across 30 countries, mainly in Africa, the Middle East, and Asia, have undergone FGMC.
200 million.
Yeah.
And like you said, this isn't just far away anymore. What's really striking from our sources is this concerning 4-fold increase in at-risk individuals right here in the U.S.
In just a decade.
Yeah, in just a decade.
Yeah.
Now estimated at over 500,000 people. 513,000. It's kind of staggering.
It really is.
And to think of children, often, under 5 years old, enduring this, sometimes in groups, with unsterile tools, no anesthetics, sometimes even with ceremonies around it. It just makes you wonder, how can something that's so clearly defined as child maltreatment persist?
Yeah.
And even grow in numbers here?
That's a powerful question. And, the answer often lies in the deep cultural roots of FGMC. Our sources really stress that it's not tied to any specific religion, which I think surprises a lot of people.
Yeah, that's a common misconception.
Totally. And historically, you can find echoes of it even in places like ancient Rome and, believe it or not, 19th century America. It was sometimes wrongly used as a supposed treatment for things.
Oh, I didn't know that.
Yeah. But within certain communities today, it's often seen as this necessary rite of passage. The belief is that it maintains chastity, preserves fertility, or ensures a girl's acceptance.
Community acceptance, yeah.
Exactly. And those long-held beliefs, well, they make intervention incredibly complex.
Which I guess is where the legal side becomes so critical. Because while understanding the cultural context is important,
Absolutely vital.
the U.S. government sees FGMC very clearly. It's a human rights violation, it's gender-based violence, and it's child abuse, period. It's been illegal here since '96.
Right.
Although, interestingly, there was that moment in 2018, wasn't there? A ruling that initially found the federal law unconstitutional.
That's right. It caused a bit of a stir. But that was quickly addressed by the Stop Female Genital Mutilation Act of 2020.
Okay.
That really strengthened the law, made it a clear felony to perform FGMC in the U.S., or, importantly, to transport a child for what's grimly called vacation cutting abroad.
Taking them out of the country specifically for the procedure.
Exactly. And the penalties are serious, up to 5 years in prison, significant fines, and absolutely no religious or cultural exemption.
No wiggle room there.
None. And if we connect this back to the bigger picture, for you, the listener, it means understanding the devastating impact that makes these laws necessary. The consequences are just severe. We're talking profound short-term and long-term trauma, both physical and psychological. Physically, things like chronic pain, recurrent infections, infertility, and really significant risks during childbirth. Tragically, including increased maternal and infant mortality.
And the psychological side.
Just as debilitating often. PTSD, anxiety, depression, a really negative impact on personal relationships. Many women feel, dysfunctional and stigmatized later in life.
So the harm is just immense on every level. And for healthcare professionals especially, our sources really emphasize the importance of cultural humility when addressing FGMC.
Beautiful.
It's about respecting the cultural context, but without ever condoning the practice itself.
Exactly. A delicate balance.
It's about building trust,
Yeah.
understanding that if FGMC happened before someone immigrated, that's not a crime here. But knowing absolutely clearly that any new FGMC in the U.S. or via this vacation cutting is child maltreatment.
And it must be reported to Child Protective Services, to law enforcement. It's mandatory.
It's a clear line.
A very clear, though sometimes difficult line. And it's so important to understand that distinction, especially when, comparisons come up, like with male circumcision.
Might people sometimes conflate them?
Yeah, they do.
Oh.
But it's fundamentally different. Male circumcision can have medical benefits, minimal complications usually. FGMC, on the other hand, is purely harmful. It's medically unnecessary, and it's specifically designed to cause injury. There's no benefit.
No benefit at all. So wrapping this up, what does this all mean for you listening? FGMC is, well, it's a deeply complex issue. It's rooted in tradition, but it carries these profound human rights and public health implications. It really demands a response that's culturally sensitive, yes, but also absolutely firm. The takeaway seems clear. Awareness, empathy, and informed action are just essential.
Couldn't agree more.
So maybe the question to leave you with is, what steps might you take now to better understand and advocate for this vulnerable population, especially knowing it's not just somewhere else, but it impacts communities right here?